Hi, how are ya? I hope you're having a great day. My husband and I have been working on the double doors. I got them stained, the doors stained. It took me a couple of days, and my husband helped me with the steel wool. He seems to know when I am struggling, and he may be a man of few words, but he's a man of action. I put wood filler on the screws, and he sanded that all down and got 2 coats of stain on it. So he's hoping today to get the doors up. He went early this morning, I think to Menards or somewhere, and picked up some door handles. And he cut those things off. So we don't have to look at them anymore. Or maybe it only bothered me, but I've had a rough couple of weeks. I think I'm on the mend now. You know, our mental health is an important aspect of our lives. And I found it important to take care of myself mentally and physically. Sometimes I think I just get down in the dumps, and I have to remind myself that I need to take things one day at a time and not worry about tomorrow. I can get a bit overwhelmed by all the things I put in my head that I want to get done. And then it takes me 5 times longer than I think it's going to. But God has it all under control, doesn't He? So instead of fixating on those things, I'm fixating on Him. And I feel encouraged and loved. About 40% of you are subscribed to my channel, those of you who watch my videos. And you're watching my videos, and I'm very appreciative of that and humbled. You're the reason I take the time to research and prepare for these videos. But that means that 60% of you are not subscribed. So I would deeply appreciate it if you like my videos. Would you think about subscribing? I'm trying to reach 1,000 subscribers by the end of the year. Maybe I'm overreaching, but that's my goal. I'm over halfway to YouTube's requirement of 4,000 watch time hours, so that's good. And it's hard for me to believe that I've made about 145 videos in the last year. But I hope you enjoy this channel and follow me on my journey of learning more about fibromyalgia and all the conditions that surround it. So today, I want to talk about occipital neuralgia, a painful condition that people suffer after usually an injury or inflammation of the occipital nerve that some of you may experience. Here we go. Many people with fibromyalgia suffer with chronic migraines, like 40% of us, but some of you may actually not have migraines at all. It may be occipital neuralgia. Occipital neuralgia is a headache disorder that affects your occipital nerves that run from the scalp through the top of your spinal cord. Sharp, stinging, or burning sensations on your scalp or behind your eyes can occur. When there's damage or inflammation to those nerves, affected individuals may experience headache pain at the base of their skulls, behind their eyes, or the back of the head. Fibromyalgia might put you at risk of other illnesses, or perhaps those other illnesses put you at risk of fibromyalgia. But either way, overactive nerves can put us at risk of neuropathy, for example. There's evidence of small fiber neuropathy and fibromyalgia, diabetes, hypothyroidism, and many other overlapping conditions, including autoimmune diseases. And any of these conditions with fibromyalgia can lead to occipital neuralgia. Your occipital nerves carry messages from your brain through your scalp. Nerve inflammation is irritation or swelling around that nerve. Occipital neuralgia can affect anyone, including people with fibromyalgia, diabetes, or osteoarthritis. Pinched nerves or muscle tightness is a common cause, but also it can occur after a head or neck injury. Occipital neuralgia is often confused with other headaches like migraines, since the symptoms are similar. However, migraines and occipital neuralgia are treated very differently, which I'll get into. Pain usually begins at the base of the head and then moves upward until it reaches the scalp. Pain behind one or both eyes is sometimes experienced, and tenderness on the scalp. There may also be continuous aching pain. At intermittent intervals, patients might experience sudden shooting and shocking pain. Because the pain is very similar to what many individuals experience during a migraine or cluster headache, they may not realize they're actually dealing with a different condition. Light sensitivity can be a warning sign, such as light hurting the eyes. It usually occurs alongside a headache and typically goes away after the headache is gone. Most of us with fibro experience mild light sensitivity without headache. We find it necessary to wear sunglasses when outdoors, especially in bright light. But extreme light sensitivity will cause you to close your eyes when light hits them. And each person with occipital neuralgia can be different. Occipital neuralgia may be caused by injury, tightness in the muscles, inflammation, or several medical conditions, including osteoarthritis, cervical disc disease, neck tumors, diabetes, gout, infections, a common cause, vasculitis, and inflammation of the blood vessels. Occipital neuralgia is often confused with other headaches like migraines, since the symptoms tend to be similar. However, migraines and occipital neuralgia are treated very differently. A migraine isn't the result of inflammation or infection of the occipital nerve. Because of this, it's important for individuals to get the correct diagnosis so they can get the correct treatment as well. Brief symptoms can occur, or long-lasting chronic symptoms. You might experience aching, burning, electric shock, sudden, sharp, or piercing pain, or throbbing. Some people describe it as being stabbed in the neck muscle. Keeping your head or neck in a downward or forward position over a long period of time can contribute to this. And this section is for educational purposes. Please consult your physician if you are experiencing issues with occipital neuralgia. This is information that I found easily during my research. So please do your own research too. Your neurologist, brain and spine specialist, may order tests such as a CT scan or MRI to get a better picture of your spine. Occipital nerve blocks are sometimes used to determine if your pain comes from your occipital nerve. It's important to relieve tight muscles by massaging your neck and stretching. Tight neck muscles can lead to symptom flares. The most common treatment is hot therapy or using heating pads on the affected area. But some people might prefer cold therapy, and magnesium supplements can also help. You might consider chin tucks. I put a couple of videos in the description section. I have done most of these through my physical therapist. They help to relieve my neck pain. So non-surgical treatments include massage therapy, physical therapy, onabotulinum toxic type A or Botox. Injections are sometimes used to decrease inflammation. It can also be used in people with fibromyalgia and migraine. Your doctor may also prescribe anticonvulsants, medications that are used to treat seizures or other brain activity, muscle relaxants, or non-steroidal anti-inflammatory drugs. The throbbing pain can sometimes be alleviated by using a percutaneous nerve block, which is an injection of numbing medication and steroids. They may also be used with the C3 and C2 ganglion nerves, as well as those occipital nerves, depending on the patient. It can take a week or two for improvement of pain to be noticed if your pain is mild or moderate. But if the pain is intense, it can take 4 to 6 weeks before noticeable improvement. The effects of the shot may wear off after 3 to 6 months after steroid injection, and you may choose to get another one. And I just saw my husband go past, so he's busy doing stuff. In addition, surgical treatment for occipital neuralgia may be tried if other treatments fail. And occipital nerve stimulation, placing electrodes on your occipital nerve to stop pain signals from reaching your brain, can be used. And spinal cord stimulation, where they place electrodes on your spinal cord to block pain signals from reaching your brain, is sometimes used. If you have more intense symptoms like vision loss, confusion, speech issues, or fever, please seek medical attention. And in my opinion, if you have any of these symptoms that I've mentioned, seek medical attention. I appreciate your prayers. I love you guys so much. I hope you learned something. I send you gentle hugs and support. Love you. For real, it says recording, but or perhaps those other of the occipital. Consult your physician if you